Cosmetic and functional rhinoplasty are basically sometimes similar procedures designed to address different goals. Functional rhinoplasty is usually a patient that comes in with a breathing problem. And so typically the problems for breathing are most commonly restricted to an area called the internal nasal valve. And that involves the septum, the side wall of the nose, so the cartilage on the side of the nose, and also the inferior turbinate that makes up the portion of the nose where the airway is the narrowest. And so when we do a functional rhinoplasty, we try to address that area, and we can straighten the septum and also perform some grafts that can strengthen the sidewall or spread it out in order to give more space for airflow. Oftentimes, patients who come in with a breathing issue also want to address the appearance, and so at the same time, we may combine that with some maneuvers that make the nose look better or in a more desired way, and that would be the cosmetic portion or cosmetic rhinoplasty. Functional rhinoplasty can be covered by insurance if the patient has insurance coverage that covers that procedure, meaning that is within their benefits, which is common. Most of the major insurers cover nasal breathing surgery. Nasal breathing is really important, and so it makes sense. But usually insurance companies want to see that you have tried something conservative that's not surgery. Tried something like nasal sprays, nasal steroids. There's a few things that you can try. Tried things like breathe right strips or other mechanical ways to open the nose, because if those things work and you get benefit from them, then you don't have to have surgery. But a lot of patients don't like to continue those things long term, and so that's why we end up moving towards nasal breathing surgery. So the question about a cost of surgery is one obviously we always get, and so the best way to get an answer to this is to see a surgeon and get a detailed quote, because there's going to be a lot of variation. The American Society of Plastic Surgeons publishes a database with basically average costs, and the average cost of a rhinoplasty for the surgeon fee is usually somewhere between $7,500 and $12,500 according to their data source, and that's for 2024. But obviously there's going to be a huge variation based on surgeon experience, expertise. How many of these do they do a year? Is this their focus? Where's their geography? More urban concentrated areas, you may see higher prices. But that's just the surgeon fee. There's also additional fees. Almost all rhinoplasty is performed under some type of anesthesia, and so there's a fee for the anesthesia, and then there's also a fee for the operating room facility. So generally there's 3 fees that make up the total quote, and they can vary a lot, and so it's important to kind of get a quote to see what it's actually going to cost.